Hi, everyone. I'm Ashley Wendel, and this is Lead Well MD, a podcast that explores how leaders can transform healthcare through emotionally intelligent, effective clinician leadership. So today we're talking about something that many physicians eventually encounter in their careers, which is the transition from clinical expert to organizational leader. And I'm joined by Dr. Rob Nordgren, who is a physician, executive leader, and someone who has navigated the journey from practicing clinician into large-scale system leadership. So, Rob, I'm really glad you're here. Thank you for being here.
Thanks, Ashley. It's great to be here. Great to be talking to you today. Thank you.
You bet. So before we dive into the conversation about leadership, I thought it might help listeners to really understand your journey a little bit, where you're coming from. You trained as a pediatrician and served as chief resident at the Children's Hospital of Philadelphia, correct?
That's right.
Yes. And then you moved fairly quickly to other leadership roles, which I found interesting, including helping develop team-based care models in New Hampshire, leadership roles at Dartmouth-Hitchcock, serving as CEO of Northeast Medical Group within the Yale New Haven Health System, and then later as CEO of Palo Alto Foundation Medical Group, which is where you and I got to know each other more than a decade ago, which is shocking. Yes. And then today you're serving as Chief Medical Officer of the Greater San Francisco and East Bay Division of Sutter Health. So it's quite a journey, and you've really seen physician leadership from many different vantage points.
I have, Ashley. I've had the opportunity to work with incredible teams and people, serve in amazing organizations, and it's really been a blessing and something I'm grateful for. Yeah, thanks for going through my history. That was great.
Yeah, well, I'm curious what drew you to leadership in the first place.
Yeah, I think a couple things. I mean, I think some of this goes back to probably my upbringing. I grew up in a house where my mom was really a leader in our community and in our state. She was involved with politics. And so I grew up certainly with a sense of community duty and leadership all around me. And I think as I went into my career, my father was a physician. And, I think blending a lot of those things together, obviously going into healthcare, but also having a sense of leadership and wanting to do more for yourself or your immediate surroundings. I really enjoy working with people and teams, and I think a lot of those things led me into various leadership roles. Yeah.
Huh. Well, it sounds like you had some really good role modeling too in your life.
Yeah, I mean, growing up and then also just incredible mentors and colleagues throughout the years for sure.
Right. Interesting. And the first thing I wanted to get into with you is this idea of that shift of identity when a lot of clinicians, it's not straightforward, is it, to switch from being in that clinical practice mindset to then be, kind of expanding past that into thinking yourself as a leader. I mean, granted, I do believe that all clinicians at the end of the day and at the bedside are leaders, but I also think that there are things that have to shift for people to take on those higher level roles. And it can look fairly smooth from the outside, but sometimes it's not so much, right, internally. So if you look back on your own journey, what do you think surprised you the most about becoming a leader in healthcare systems?
Yeah, I mean, I'll pick up on a couple threads that you mentioned, Ashley. I think, first of all, one of the things I always emphasize to, physicians and everyone really who has various roles in healthcare is they are leaders. My diet partner and I just led a summit last week, and one of the themes was you're the CEO of your area. And I always try to convey to physicians, if you're a physician on the front line and seeing patients, you probably have a team. You're seen as a leader in that setting. If you have a formal title, you're leading a department, et cetera. So I think just the mindset, and I start with that because to really get to your question, I think physicians who come into leadership roles, certainly formal leadership roles, I think the way I look at it is it's not a change in mindset, but really the ability to have more, to use a metaphor, tools in your toolbox. I think that the best physician leaders never give up the notion of what it means to be an individual clinician serving a patient. I think actually bringing that along in their leadership journey is key. But I think it's about a broadening. It's a broadening of perspective. So if you go from being a frontline clinician to leading a department or a larger role in a health system or a service line, it's about broadening your perspective and understanding that who you're representing, the interests that you're representing, or the goals maybe that you have to achieve get more broad. And so you have to be able to adapt that perspective and adapt to whatever that situation is. So as I've viewed very successful physician leaders around me, it's watching them be able to broaden that perspective from being an individual to part of a larger team and somebody with, again, larger, more broad goals and constituencies.
Well, interesting. I think because for some people, I think they see leadership as an extension of clinical decision making, but really there's a whole other set of instincts that have to be built into that. Would you agree with that as part of the expansion?
Yeah, I think so. I mean, I think some of the same themes that go with being an individual clinician, things like trust, humility, a lot of
Right.
the kind of leadership traits that I think we view as really critical and foundational. You do this work every day. Things like, emotional intelligence, being able to communicate well. I think, again, a lot of those things exist maybe in slightly different ways for an individual clinician.
Right.
But they really take front and center stage when you're talking about a clinician leader.
One of the things that I talk about a lot when I'm working with clinicians is the need to change hats. When you have your clinical hat on, the way that you approach things and the expert mindset that we talk about, that's all very appropriate. When you switch hats, and I think sometimes that's hard for people to do, especially when they have to do it multiple times a day. And when you put on your leader hat, I think things shift a little bit because sometimes the things that can make you very successful as a clinician can get very much in the way when you're trying to lead other people. Would you agree with that? There are aspects of that we need to unlearn a little.
Yeah, no, certainly. And I think it is, again, being able to adapt. I think best leaders, clinicians or not, understand, what is the setting I'm in right now? What are the skills? What is the viewpoint? How do I communicate and think about what is the role exactly, sort of the role clarity? And so I think that's critical. I think for clinicians who I've been in meetings and some of them even recently where I've watched clinicians struggle with taking a little bit more of a broad perspective. And so again, I think it's really having that self-awareness, but then also situational awareness. What is my role here in this
Right.
conversation, in this decision making? And for clinician leaders, it's probably different than the scenario when you're sitting in an exam room with an individual patient. There are things,
Right.
those types of interactions that you need to pull forward, and there
Right.
are some similarities, but certainly as clinician leaders broaden their scope, they've got to have more tools in the toolbox, so to speak, for sure.
Well, let me ask you about that. It's interesting because I think it's an evolution, right? As people get, you know, as their leadership changes, as they evolve a little bit, and as they get into higher levels or more systemic type responsibility, accountabilities. What for you had to evolve most importantly as you moved up in that way? What skills do you feel you really had to develop more than others?
I think for me, as some of my roles broadened and I came into contact with sort of larger groups, a larger scope, I think something that comes down to building trust. How do you build trust? Obviously, as an individual clinician, you have to build trust. Or if you have a smaller local role, I think it really came down to really understanding some of the basis of trust. My view is building trust is sort of foundational to all aspects
Yeah.
of leadership. And so it was really understanding what does it take? What are the even components of trust? And as a leader, how do you show up to build that, whether you're building trust with other clinicians or administrators? So to me, we're all always on a leadership journey. And that's one of the things I love about leadership. It's like being athlete or something, or maybe
Yeah.
not a great athlete in my case. Anyways, it's about just always being on that journey and being able to adapt as you evolve in that journey and building new skills. And again, having new skills.
Yeah. Continuous learning, continuous evolution. And that's the one thing I do love about working with clinician leaders is you guys are incredible lifelong learners. There, vast majority of people I've ever worked with really want to continue growing and learning and finding more and building more into their toolkit. So it's really fun that way. Yeah.
Yeah, and I think the best leaders are folks who realize that leadership is an ongoing journey, and you've always got to be learning more,
Yeah.
always be doing better. And I think it's really being curious. I think to me, that's another key leadership
Yeah.
attribute. That's one of our values at Sutter Health that I really love. Just the notion of being curious means you're willing to learn. It also means you have a certain level of humility because you come to the table recognizing that maybe I don't have all the answers. I want to learn from other folks. And I think that really, as part of the DNA of a leader, is really key.
Yeah, agreed. Agreed. So, what do you think for physicians who are moving into leadership roles, higher level, more official, or even systemic leadership roles? What do you think trips them up the most? What's the hardest or the thing that you see gets in the way most often as they're trying to develop these skills or even put them into practice?
Yeah, I think it's a couple things. I'll just reiterate one of the things I mentioned before. I think first it's really having role clarity. And again, if somebody comes into a leadership role that's more broad, really understanding in that role now. There's that famous book, the title "What Got You Here Won't Get You There." I think it's one of everyone's favorites. And again, it's that notion of, okay, I'm in a different role. I need to bring different skills or thoughts or perspective to the table. So I think that's one thing. I think another thing that I put a lot of value on right now at Sutter Health, we're going through our performance review season. So I've been viewing my team. And one of the things I really emphasize with the physicians who report to me, and I think it goes for all leaders, is just the idea of emotional intelligence. And you asked why I see trip up physicians. I think physicians who become successful leaders, to me, what they all have is a certain level of emotional intelligence. And I'll come back to that. I think, every physician, probably if they're in a leadership role, has some clinical background and expertise.
Absolutely.
That kind of gets you in the door.
Yeah.
You're a clinician, you've got that credibility. But what I see as is really one of the key differentiators when it comes to physician leaders who succeed is, again, that ability of having emotional intelligence, which means you are very aware of yourself. We could have a whole podcast on emotional intelligence.
I think we should.
That's really, where I see those that are successful. I just hired a chief medical executive at one of our hospitals in my division. And he's doing great. And the reason he's doing great is he's coming in with humility. He's got a ton of emotional intelligence. When he brings me scenarios or issues, he's really keyed into the emotions or the feeling driving the situation. So again, back to your question, what sort of differentiates or can people up? I think this idea of being able to read the room and understand what people's interests are, and then, to use a cliche, meet them where they are. So I think when I see physicians struggle, it's really around a lot of that. And I think it does get back to also how do clinicians adapt? Physicians are used to being the expert in the room. They have a ton of expertise probably in their clinical area. But to be a successful clinical leader, physician leader, you've got to recognize that maybe you don't have all the answers. You need to work through things with people. So it's not about having the right answer first. It's about creating an environment to bring that out and on.
Well, and that's the thing that comes up again and again in programs and classes and groups that I do is that the difficulty of shifting away from being the one who has the answer because you are trained to have the answer. It is a very comfortable place. And even if you have the answer, giving other people the opportunity to find the answer as well and having the humility, like you say, to think that maybe their answer could be as good as yours or even better, right? And that's hard for people. That is really tough.
Yeah. I think it's hard for people, and it also can be one of the best things about leadership. It's really one of the things that I love about being a leader. I was saying to some folks the other day, I mean, what brings me joy about being a leader is actually helping or watching my team succeed, et cetera. And I think to me, when you can get over that hump, whether it's ego or other things, let go of some of that and recognize that, hey, I'm here to help others succeed, whether that's through coaching or promoting a very psychologically safe environment, bringing answers out of people. To me, that's can be the most gratifying thing about leadership for those who there.
Well, let me ask you, I think one of the hardest things too is when times get tough, when stress goes up, when things are moving really fast, that's a challenging thing sometimes. People tend to revert back to old habits and old behaviors. So, what would you say to that? Because that's just the environment that we all live in, right?
Yeah, I mean, healthcare is very stressful. It's
Yeah, it
complicated. There's
is.
a lot going on. No, myself personally, I'm in some stressful meetings every day. And again, I'll go back to this notion of emotional intelligence where you have to first know yourself and you have to recognize when you're getting stressed or you're getting triggered. It happens to all of us, but what you have to be able to do, I think, and it comes with years of practice, and we're never there. I know I'm always working on it, but is really the ability to have that sense of yourself and when are you getting stressed, and if you're feeling stressed, making sure you keep some of those emotions in check to some degree.
Right.
At the same time, you've got to be able to show your emotions, but appropriately.
Yeah.
Um, but I think it's really about it just getting back to the stress, recognizing that things are stressful, and also I think being able to recognize that no matter what the situation is, sometimes just calling that out. I mean, we're involved right now. I'm involved with a pretty complicated collaboration with another organization, and it's a stressful process. There's a lot of change and change management happening. And one of the things I find myself doing in some of those meetings is just calling out, hey, this is hard work. We're going through the hard stuff right now.
Yeah.
And so, just going back to your question about stress, you've got to be able to recognize it in yourself. You've got to be able to sort of modulate it within yourself. And then you've also got to have the authenticity to call out stressful situations. Because if there's a lot of emotion, no matter what type of emotion it is in a situation, and you're not acknowledging that as a leader, you really are losing on the whole authenticity piece of
Oh, entirely.
yeah.
Entirely. And I think by naming it, you're giving other people permission to recognize that it's in the room. Everybody knows it's in the room, the stress, whatever it might be. But if you can just acknowledge and say, this is really difficult right now, and I have the confidence that we can work through this in a way that's going to get us where we need to go. But I think sometimes leaders don't want to say that it's hard because they think somehow that's going to create pessimism and fear. But I think it's the opposite, to be honest.
I completely agree, Ashley. I think calling it out and then having, it's to me about realistic optimism and
Yes,
form of
exactly.
that is, the realism part is calling out when things are challenging, calling out when maybe there's stress in the room or situation, but also being optimistic that, hey, we can do hard things. We can do this. My belief, and I was just saying this to somebody the other day, is, I think to be a leader, you have to be an optimist. You have to believe that the world or your situation can be better in the future than it is today, sort of the definition of being an optimist. But, you can't over-index on just the optimism. You've got to be a realist, and you have to be authentic about what the challenges are and so I think one of the things for leaders is coupling those two things, being realistic and painting the picture and what the challenges are, but at the same time believing that they can be worked through and we can get out the other side.
Exactly. I think that's the most important part. Whenever we've talked about optimism in leadership classes, people worry a lot about toxic positivity, which I entirely agree. If you just tell everybody, "Yeah, it's going to be fine. It's all good. It's great," and you're not addressing everybody's anxiety that's in the room, you're not going to get any further. So I love this approach because I think it's absolutely true. Realistic optimism or optimistic realism. It's one of them.
Yeah, combined of both. Yeah, exactly.
But saying that I see it, I see how difficult this is, but I see the horizon and I know where we're going and I have confidence that we can get there. I just think that's great. Let's talk a little bit more about the whole idea of building trust in these very complex systems with these very complex things that you are challenged to do. So you work with a lot of different groups in the role that you're in the system level role. You've got physicians, administrators, operational leaders, and they all tend to come with different approaches to the same issue oftentimes. So in your experience, what builds credibility fastest for physician leaders who are tasked with working across those different disciplines?
Yeah. I think, Ashley, I'm going to go to my favorite model of trust, Francis Fry's model about, the trust triangle. And I'll just quickly mention that. I think what I like about that model, and I use it in my head all the time, is just the notion of there's a part of trust that's competency. Do
Yep.
people think you can get the job done? There's a
Sure.
part of trust that's really alignment. Is this person's interests aligned with mine? And then there's the whole notion of authenticity. I'm seeing the truth and the true person here and all those sorts of things. To me, how do you build trust quickly? I think people want to see that competency piece. And where I'm going with this is I always encourage new leaders, especially, to try to get some early wins. If you're coming into a new situation, if you're coming into a challenging situation, identify things that can get wins. A, because that's good. It's good for, whatever the project or the situation is to get win, but also just the idea of building trust. People are going to see that you're aligned, see that you're competent. And so I think, to me, building up trust is about trying to get some early wins. And the other thing I'll say is doing some really good listening. I mean, I think,
Wow.
Showing up, meeting people where they are, understanding their needs, wants, concerns about whatever topic may be. So I think it's those types of leadership behaviors can really build some trust. Yeah.
I mean, caring enough to hear people's points of view and needs and thoughts and concerns and worries. And the other part that I would add to that is the follow-up, the follow-through is a really important second part of that listening, because if people feel like they're just sharing things that never go anywhere, they don't hear anything back, then obviously that's an issue.
I think that's really key. And I think that's sometimes where we fall down. And where I'm going with this is I think that I hear about it all the time. There'll be a concern in a department or wherever it may be, and folks will feel like nothing's happening. And with that concern, there's no follow up. And then you talk to the leaders, they're like, oh, yeah, we're working on, et cetera. And so it's really, it's about communication. You mentioned it as follow up, but yeah, what's happening on a particular issue. And even if you can't solve it right away, I think as leaders, we're often worried about saying, you know what, I can't fix that right now, or feeling defeated or whatever. I find that people have a good amount of grace if they feel like you're on their team, you're aligned, and you're trying to fix something. And so even if something hasn't been solved, going to the group and saying, hey, you brought up this issue. Here's what I'm doing on it. It's not going to be a quick fix, but here's what we can do. I think that's really critical communication. And then again, even if it's easy stuff that's gotten fixed, make sure people know about it. And it's not about just, putting points on the board, getting credit. It's about really building trust and showing people respect that you heard their concerns, you're addressing their concerns. And so, you sort of follow up. I think that's always really key. And I think, right now we do our clinician engagement surveys in the fall, and, we've got work plans and all that. When I'm hearing about how those plans are moving forward, I always emphasize, to use your word, the follow-up. How are we showing progress, communicating to people the work we're doing, being transparent about our challenges? All of that is critical.
That old adage of it's not what you say, it's what you do. I think it's that, because I think people, even if the communication you have with them is wonderful and supportive and great, if there's not action that demonstrates that you've heard them, I think that can be more trust depleting than anything, no matter what.
100%. No, yeah. I think, again, this goes back to the term follow-up that you used. I mean, if there's been an issue communicated, you've got to be, on it, but then also doing the follow-up to make sure folks know that not only about solving the problem, but we heard their concern. That obviously conveys a good amount of respect. So
Absolutely.
That's critical. Yeah.
Yeah. And I would say that in a absence of communication, or even if leaders think, well, we got this, they know, everybody's on the same page, and we make a lot of assumptions. Problem is, if there isn't communication with clear direction of things that are happening, people will fill it in. They're really good at that.
And what they fill it in with is sometimes from a dark place or some skepticism. Yeah, no, I think, I think it's very true. I think, and again, you don't want to leave to chance with what the void is getting filled with. So it's just,
it's being intentional. We're never going to be perfect in this process entirely, but it's being intentional in that. So, what do you think on the flip side? What happens to undermine credibility in physician leaders? What specific things do you think get in the way?
Yeah, I think so. You framed it as undermining credibility. I think,
Mhm.
I would think about that as a loss of trust. I think,
Uh-huh.
I'll start with the idea of alignment. I think if people feel like their leader is not representing their interests or communicating their interests and
Right.
something happens, and we've all heard the phrase top down.
Yes.
When
Yes.
people feel like there are decisions made that they're not part of, or at least having input into, that can erode trust pretty quickly, especially if it's significant things that affect them and their day-to-day work. So I think it's really losing that notion of alignment. I think that can really erode trust. I think there's also just a level of competence. Again, just going back to the whole trust triangle and what are the components of that. If people feel like just you might be a nice person, they like you, they want to go out with you for a
Beer
beer,
with you.
but you can't get the job done, that erodes trust, and that can erode pretty quickly if there are mistakes made or
Yeah.
operate things not happening correctly. So I think those are a couple things where, again, just feeling like there's a lack of alignment or feeling like a leader or their team is not able to get the job done. I think those things can certainly erode trust pretty quickly. And it goes back to what I mentioned before, that notion of getting early wins, that you are, competent, you can get stuff done, and you've got their interest, you're hearing what their needs are. Yeah.
Let me ask you something. We haven't chatted about this before, but this is something that comes up a lot when I'm listening to and working with leaders and groups. If you've got a leader that's kind of right in the middle, right middle level, they've got their people below their peers and they've got people above them, and they've got things that they're being asked to do that they're being asked to then cascade and roll down, right? That they're not entirely bought into. And yet they're being asked to take that down. I know you hear this all the time. So, what would a piece of advice be for somebody like that if they were in that circumstance?
Yeah. First, I'll just sort of acknowledge the scenario you're painting. It's challenging. It's
Yeah.
challenging to be
Yes.
in middle management. I think as
Yeah.
physicians, we feel a lot of loyalty to our colleagues. There's a few things that I try to do or coach people. I think number one is, you mentioned maybe you're not 100% aligned with something, but I think
Thanks.
understanding the why. And so I think
Mhm.
one of our key jobs as leaders, no matter where we are in an organization, is to communicate the why. And I know
Right.
clinicians, and it's true for everybody, when you're making a change or pushing something through, or you have a strategic objective,
Yeah.
starting with the why. Why are we doing this? Why is this good for our patients or the organization or in your department? So I think that's one thing I would always recommend, is for that leader to understand the why, ask clarifying questions. Our job as leaders, one of them is to communicate clearly to folks who we work with. And you can't do that if you don't understand why something's happening. And one of the things I love that we say in my organization is seek clarity. So if
Right.
you have clarity of why something's being done,
Right.
you can't communicate it, but it's your job to seek clarity. And I try to do that all the time, or
Right.
just really listening. And so I think that's one really big thing, is if as a leader, you're going to have to be communicating and maybe even implementing changes or whatever it might be, a strategy, you've got to understand the why, and you've got to be able to communicate that. I
Mhm.
think the other thing you've got to do then is listen and really understand if there's anxiety about a change or questions about it, really listening to those and trying to
Right.
address those. So I think, again, middle management can be really tough, but understanding the why, being able to communicate that, and then really engaging folks to give feedback and make that authentic. It's not just about window dressing feedback, but really
Right.
and giving folks a chance to ask questions and give feedback and that sort of thing.
Yeah.
I think if you can lean on some tactics like that, it's helpful.
Yeah. And when you say understand the why, you're talking about if you're in that middle role, it's appropriate to take it up and say, I don't understand why we're doing this. I need to better connect. If you're asking me to ask my people, I need to really understand. So that's an appropriate,
Yeah,
managing up, right?
exactly. Exactly. Just to emphasize that if you're being asked to communicate something or
Yeah.
understand again a new initiative or a
Yeah.
strategy, your first job is to understand it pretty well
Right.
and to understand the why. Doesn't mean you agree with it 100%. You agree with it some high percentage.
Some
Part of your job is to seek that clarity so then you can communicate that clarity.
Right. Right. I think it's interesting because I think sometimes people just feel stuck. They don't feel comfortable or they don't realize that they have the ability to take it back up and say, there's parts of this that I don't understand or that I don't feel comfortable with. I mean, it seems like I'm hearing, at least at Sutter, that this is an appropriate thing for people to be able to do.
Oh, definitely. I mean, we
Yeah.
have a culture where that's expected, that transparency, and just being really honest. There are tough things that sometimes we have to communicate or changes, and I think
Mm.
that's part of being a leader. And one thing we haven't really touched on yet is just the courage of being
Yeah.
a leader. I think we've talked a little bit about what are differentiating things in terms of leadership, and another one I'll put out there that is sort of top on my mind lately is just the ability to have courageous conversations.
Yeah.
The
Yeah.
I
Tell me
think
about that.
that is a differentiator. I think for certainly for physician leaders that I work with, is it somebody who can have a tough conversation, obviously diplomatically, hopefully with a good outcome. But I think, a lot of people, especially if you're talking about having tough conversations with other physicians or your colleagues, I think that's a real differentiator. So you combine that emotional intelligence that we talked
Yeah.
about before with that ability to have courageous conversations. When
Right.
I see physician leaders struggling, it's usually around those two things.
It's so interesting. It brings up the whole idea of having healthy conflict. And that's another thing that we talk a lot about because, firstly, it's just switching people's mindset to understand that it's not always a negative. There are some very solid, positive things that come out of good conflict, healthy conflict. And so I think having these courageous conversations is a huge part of that. It's a demonstration of that. Give me a couple of examples of a need for a courageous conversation, a couple of scenarios just to really give this life.
It might be, let's say you have a department and there's a proposal to change some of the staffing in the department. Maybe that's to care for a different population of patients, but it's really to use the imagery, moving the cheese potentially for some clinics
Yes.
or others. I think that's something that comes up for a lot of physician leaders, or that there's new technology, or a lot of physicians have struggled with the electronic health record. How are we going to support all the messages in their in basket, changes like that. And I think, so those are, I just threw out a few different sort of operational things that could happen at a department level where if there are changes happening, again, you've got to be able to understand the why that's happening.
Right.
Meet people where they are, understand their
Right.
concerns. We talk about this notion, Ashley, of change management. And one of the things I always focus on when we're doing any change management is really focusing on what are people losing.
Yes.
I think
Yeah.
that we all know that some change isn't hard, right? If you have kids and you're going to
Yeah.
tell them they can have two desserts instead of one at night, that's a change, but you're probably not going to get a whole lot of pushback. So one of the things I always focus on and coach people to focus on is if there's a change happening, what is the loss? What is the anxiety? And real understanding that. And so it's about communicating the why from your perspective, but then also meeting people where they are and
Yeah.
and really delving into that. And then if there are certain issues that are really barriers to implementing a change, how can you engage people to solve those
Right.
problems?
To those problems. Yeah. I think one of the biggest things that I feel is important that any change has impact, whether it be positive or negative. And I think sometimes we think we're only going to see resistance if it's a negative change, but it's well documented that there is also resistance that
Yep.
happens when it's a positive change. And with negative change, you'll see people typically go through those stages of grief. And it can be something as small as moving their desk. And, it's just really, we're just human creatures. We don't like a lot of change.
Office furniture is it's a
Absolutely.
hot button topic for
Oh
sure.
my
Yeah.
gosh. Yeah. Especially if it's done when you're like not there and you show up and it's all changed. But the second thing is, though, even with positive change, you can have people that just jump on board and everybody's good. But then at a certain point, they'll start checking out because if they don't have enough support or if they don't see things going the right way, I mean, there's a lot of resistance that can be quieter that continues to happen. So I think we can never underestimate the impact of change and always be mindful.
I agree. You mentioned a couple things, Ashley. You mentioned earlier,
Yeah.
you know, having healthy conflict. I think,
Mhm.
and then you just mentioned people sort of going quiet. And I think where
Mhm.
my mind goes around those concepts is, someone once said, alignment happens out loud. And what that means is
Yes.
it can feel uncomfortable. It might
Yes.
involve some debate or heated discussion or whatever, but it's actually a good thing if you're seeing that. If everybody's quiet and
Right.
you're not hearing anything,
Right.
there may be some alignment issues and you're just not
Right.
getting at it. And so I think, and that's where the courage comes back because you've got to be willing and able to be uncomfortable
Yeah.
to have those types of alignment discussions. And I think, again, those things kind of happen out loud. We've had this in the division where I work in Sutter Health. My partner and I, we went through a process to really hone in on a few key goals for this year. And we did that with
Mhm.
our leadership team. And, we had some good discussion and debate about that and how to present. But it happened out loud and people were expressing themselves. And then frankly, what was great about it is because it happened out loud, we ended up with a better product and a better way to
Okay.
present some concepts. And so to me, it was an example of making sure we can have dialogue,
Yeah.
be open to that dialogue and learning from it.
And yes, and creating a space where people can surface the issues that are in there because they're in there, right? And then the old saying that silence does not equal agreement. Ever.
That's
It's so funny. You just reminded me. I did a podcast with a fellow who was a colonel in the Army. He's a retired colonel now, Randall Wickman. And he was telling a story about when your troops get quiet, when they're complaining, they're engaged. Everything is okay. But when they get quiet, you have a problem.
yes.
And it just made me think of that. Yeah.
Yeah.
Well, okay. So, how has your understanding of when you see resistance, because when change does create kick up, pushback, anxiety, how has your understanding of that evolved over your experience in leadership?
Yeah, I think it goes back to what we were just talking about. I mean, I think, you know, you did a nice summary when we opened up of my career and I had a chance. I was really lucky to be in some leadership roles pretty young and early in my career.
Yeah.
I think when I look back when I was young, I think when difficult conversations or group conversations would happen,
Yeah.
it's what we've just been talking about. I would feel like that was a negative versus now, you want to channel it, you want it to go to a good place in terms of being constructive.
Right.
But I think I'm much more open to, hey, this is good. We need to have good open dialogue, maybe some
Right.
disagreement, maybe some debate, and just being more open to that, recognizing that needs to happen to get to a better place. I think that's been
Right.
part of my evolution over the years.
Well, I think that's absolutely right. And I've worked with groups where they didn't want to involve their physicians in big, major changes, system implementations until the last minute. And I'm thinking, why? But, they just didn't want it, right? But so they think it's going to somehow be worse or it's going to get derailed. But what do you think about that?
Well, I think another cliche that I don't love, but it's useful sometimes, the whole notion of go slow to go fast. I mean, I think, what the scenario you just outlined, don't bring in the physicians until the end or whatever, bring them in right up front. It might feel slow at first, but, getting that input, getting that alignment is only going to be an accelerant later on.
Yeah.
And, we've all seen scenarios where people get brought in too late in the process, or there's got to be a lot of catch up in terms of communication. That slows things down as well. So I think when in doubt, bring in the key stakeholders early on, be really clear about what you're trying to achieve with them. Yeah.
Yeah, no, that's change management 101. But,
Yeah.
a lot of times people shy away from wanting to do that, but I agree with you 1,000%. Let me ask you just a couple of questions about the pace of change right now, because I think a lot of leaders, like, we need to move fast. People are moving 1,000 miles an hour, but how do you feel about the pace of change and how you choose to pace change right now with everything that's going on? Yeah.
Yeah, I think the pace of change certainly is fast. There's a lot happening in healthcare. I mean, we can't have a conversation without mentioning things like AI or
Oh, yeah.
payment changes, the political landscape and how that affects healthcare, challenges with just recruitment, retention, et cetera,
Right.
needing to serve more patients. So we could go on and on. There are a lot of challenges today in healthcare, and I think it's really about how do you modulate the pace of change. I think it's recognizing where your teams are at, how quickly can they move or
How
adapt.
ready are they?
Yeah, exactly. So I think some of that is just as a leader being able to gauge where people are at and how quickly they can move on something and being able to dial that up or dial that back depending on the situation. And that really comes down to listening to people, hearing what their concerns might be, and then just having a good sense of how much of a change is this really going to be for a given constituency.
And what do you do when you do get pushback? Like we can't take another, change initiative right now. What do you do with that?
Well, I think you've got to then sort of prioritize.
Yeah.
And I think you've got to recognize and be able to, I mean, there are some things that absolutely have to happen, right? And so maybe it's a regulatory issue or a quality issue that's affecting patients. And it's like, we've got to get this done. Now, getting pushback on that, then again, you need to meet people where they are and figure out, well, okay, are there things we can stop doing to make space for this? Are there other priorities that we can deprioritize? I mean, I think it is, again, listening to people, understanding what their bandwidth is, and then if they have concerns, and then also just being able to modulate, okay, whatever that initiative is, how critical is it? Does it have to get done today or this week? Or if it gets done 6 months from now, is that okay? You've got to be able to have that judgment too. And then, being able to communicate that urgency, I think is also key. Urgency is another word I've used with some of my team recently is, we've got some stuff that's got to get done, operational things. And I was coaching somebody recently. I said, we've got to bring some urgency to that. And that is, again, a leadership skill
Right.
to work with teams
Right.
on amping up that urgency, but also meeting them where they are in terms of, okay, what are the things we can take off your plate to make space for this?
Yeah. In change management, we used to call it the burning platform. What is
Yes.
that? Why do we have to do this right now? But it's helping people see that, understand, and then what their role is and how it's going to impact them. It's a lot. What role does transparency play in all this from you and your role?
Yeah. I mean, I think transparency gets back to the whole notion of trust that we were talking about. And I think you've got to be as transparent as you can be. I mean, obviously there are sometimes things that you can't reveal at certain times, but with that said, I always erring on the side of transparency. Transparency builds trust. Lack of transparency, you're going to have some issues, but it also just helps with engagement. I think even being transparent about something that you're struggling with as a leader, I think it goes back to what we were saying before about being able to share your challenges, being vulnerable. So I think being transparent is critical on many levels, and we've got to recognize how critical it is to building trust and getting stuff done.
Well, you hit a touch point, the vulnerability thing, because it's interesting. I think a lot of people struggle with knowing how to balance that. How much do I show, right? How much do I keep me close to the vest as a leader? Is it appropriate to show it? I mean, what would you say about that?
Yeah, I think we have to be comfortable having a certain level of vulnerability as a leader. I mean, I think that whether that's sharing how you're feeling about a particular issue at work or what are your emotions about something, we've sort of touched on some of this over the course of this conversation. But I think that authenticity of being able to express, what are the challenges you're feeling? What are the challenges you've run up against as an individual? I think a lot of our culture has been to not show those weaknesses or vulnerabilities, but I think we know that when people can identify with you, when people can identify maybe things that you express, again, whether it's emotions or challenges, they identify with you, and
Yeah.
that's good. It's good for our human relations. It's also good
Yeah.
just creating an environment where people feel comfortable themselves sharing. If people feel like you're unapproachable or have this aura of not having any vulnerabilities, it's tough for them to share what
Wow.
they're thinking. And that's frankly something that I've had to learn over the years. I think, again, just being willing to share. We're all sort of competitive. We want to do great work. And so, sharing where maybe you're struggling a little bit can be a
Yeah.
challenge.
I think it's so important. That shared understanding of each other it gives each other a chance. It gives grace to each other. Like I was thinking about this with working with different teams across service lines where they really had a lot of assumptions and things going on. It's because they didn't really fully understand what they were all what they were all experiencing and dealing with and having trouble with. And once they started to know that, it's amazing how that brings the tenor down. People are able to cut each other some slack because we see it. We are all human in the process. So I agree with you about the transparency and the vulnerability and sharing that, but you have to work up to that, I think. Yeah. Yeah. Okay, I'm going to ask one last question, all right, before we close today. So if you're thinking forward, if you think about the next generation, people coming in, leaders coming up, what capabilities do you think are going to matter the most in the future in healthcare as we know it right now? What do you think?
Yeah, I think I would pick a couple that I've mentioned in this conversation. The first is that notion of just emotional intelligence, being able
Yes.
to understand yourself, your own emotions, and then also to meet people, to resonate with people in terms of what they're feeling. I think that's, as we talked about earlier, most clinicians come into the room metaphorically or come into a leadership role with certain technical expertise.
Right.
That's sort of table stakes. But the differentiator to me is often how can they really connect with people. I think the second thing I would say is another topic I mentioned earlier, which is being able to have courageous conversations, to be able to have the difficult conversations. I think that's a real differentiator. Again, it's people can go through leadership roles and they want to be liked, and we all want to be liked, but if we're going to really move stuff forward, if we're going to take on challenges, whether it's healthcare or any other area of the world, we've got to be able to have challenging conversations. So to me, those are probably the two things that are, when I work with clinicians or coach clinicians or have it's really that emotional intelligence, being able to resonate with people, and the ability to have crucial conversations.
Isn't it amazing, Rob, how it comes down to the human factors? At the end of the day, when we talk about effective leadership and we talk about how things function optimally in these large systems, it really comes down to human dynamics.
We are emotional beings, and if we can't connect with that, when we've got challenges, and when we do connect with that, what we can achieve is really incredible.
It is. It is. Well, I really appreciate you today. Thanks, Rob, for doing this and sharing and having this great conversation with me. And I'm going to reflect a little bit on what we talked about and some of the things you said.
I will too, Ashley. Thanks. This has been great. Thank you so much. Appreciate it.
All right, Rob. All right. Take care. As you reflect on this conversation, consider this. For many physicians, leadership begins with expertise, but over time, it asks for something more. It asks you to step back and broaden your perspective and lead not just the work in front of you, but the system around it. Remember that influence isn't defined by your role or your title. As Rob shared, it's built through trust, it's built through relationships, and through how you show up when things are complicated, which, as we know, is every day. Thanks, everyone, for being here. Take care of yourselves, and I'll see you next time. Lead Well MD is produced by Ashley Wendel and Physician Leader Group. Get new episodes as soon as they're published by following Lead Well MD on your favorite podcast app And don't forget to share with your colleagues and spread the word.